And now I would like to invite Dr. Divakar. And if you could please reflect on, based on your clinical experience, what are some challenges that you think that pregnant and nursing mothers can face that could potentially benefit from group-based interventions? And what are some opportunities in a clinical setting for some of the group-based initiatives? Thank you. Over to you, everyone.
Namaskar. Thank you, Rashmi. And thanks to the organizers, including mainly Vani from UNICEF, who has been the integral force in unifying all of us, breaking the silos, and we are on a common platform. It is, of course, my role to move out of not only our ivory towers in private practice, but also in our community of the specialist OBGYNs and the whole teams of healthcare providers that we deal with through our organization, FOXY, to do much more than what we have been doing until now. So my heartiest congratulations to so many of the groups who are working very intensely for the nutritional aspect of health, and if with the philosophy of connect and collaborate, if we as professionals can also lend a helping hand, then the saying, together we can, actually will turn our dreams into reality. Well, as all of you, we believe that women's health is nation's wealth. So no matter which age group, some said start in adolescence. Yes, that's a fine point to start, because before she embarks into pregnancy, we want her in the pink of health. Then the target group, which is largely available to us as clinicians, of course, is the pregnancy group with all its inbuilt complications in most parts of the country. And then beyond pregnancy, the postpartum, where many of the pregnancy complications forever and forever lead to the NCDs, a tsunami in the generation next as well. So giving a wholesome importance to nutrition right across her journey throughout her age groups. The women themselves, now it was said that the demand generation, so the women themselves who eat the last and who eat the least should recognize that their health is so crucial and so important for everything that they do. If they are in the self-help group, if they are in the microfinance, if they are going to be productive beyond reproduction, for every aspect that they are the key, and the nutrition is the base. So what opportunity do we have as clinicians? Well, to confess, really the nutrition aspect of it, we just see through that in clinical practice. We have been given a very standardized guideline by our own government, bringing to our notice that 1 in 5 women is underweight. The prevalence of overweight is also obviously increasing. Every other woman is anemic, and just a very smart, quick checklist of what we are to document on every pregnancy at her visit, whether she's short, whether she's young, whether she's a low BMI, even the height weight record, it's not really documented in the way that it should. And many do not know what MUAC, the mid upper arm circumference. Many of the clinicians and healthcare providers in practice cannot even relate to that term. And of course, the new tsunami of the gestational weight gain and not being able to reduce it as in the postpartum period, and a number of allied interferences, both with absorption of the nutrients that they would take, or the medication that they would take, or the health parameters which are affected and implicated with a series of what is listed on to the corner of this slide. So what do OBGYNs do? The reality bites, because generalized diet counseling is there. It's not contextualized. It's just in general, okay, eat well. Then families also ask doctor what she should eat, because in pregnancy, no matter how she's taken care of in the other parts of her life, but in pregnancy, she's really pampered and made to eat for two, because every attention is diverted to the new life which is going to be joining into the family. most often we focus only on anemia and some cash transfers where the take-home ration, etc. We are not so much in sync with whatever else is happening. And the counseling is not a systematic service at all, because as you see in the last line here, we are more focused on prescription rather than the diet advice, and general, advice is given, and therefore the capacity building of both the specialists and the whole teams of healthcare providers in any unit, public or private, so that each one teach one principle should work well. And oftentimes when we have tapped the information from the gynecologist, they say the gestational diabetes is becoming a huge issue now, and they're all sensitized to it. That so only when the sugars are high in pregnancy, they start ticking their brain onto some kind of specific nutritional advice that they have to give them. As I said before, seldom the height, weight, BMI calculation is noted. Worse still is nobody is tracking the weight gain of that patient. Even if she's severely undernourished or obese, the month-on-month visit, even if she comes for least number of visits or maximum number of visits, attention to the weight column is not really paid, and that is the truth of the matter. So in collaboration with FIGO, the eDialogues that we first kickstarted has now evolved into this series of programs. But I must confess that out of 40,000 OBGYNs, there's just a handful of us who are at the moment sensitized and paying attention to this. But we know that, yes, if the demand is generated, then the supply side, as in every healthcare provider in the chain, should be sensitized as to what should be said, how it should be said, and how it should translate into their behavior change to get some impact. So everywhere we are now emphasizing the 1,000-day window of opportunity, with good maternal nutrition being the best start in life. And I think we are slowly beginning to get there. And then much was talked about the technology. Let's absolutely not underestimate our girls and women. Facebook, Instagram, WhatsApp, YouTube, video consultations, consulting the lactation consultant from our unit, right from interiors of the country on the video call, with some people wanting to know about the milk bank. So they are kind of very eager to ask. Sometimes language becomes a barrier, because there are many girls and women out there who want of course the counseling in their own language for them to understand better. So this is very much a part of the new normal, escalated because of the COVID-19 pandemic. But there is a huge opportunity for us to give out the uniform messages, sharing, and make a good use of the waiting time, both in the public and private sectors, and telling them to eat right. The challenges are around the lack of information and several misconceptions and fears. Eating for two, however much you tell the lady to restrict because of a health condition like gestational diabetes, it may be with the mother-in-law or other family members. So it's important to counsel the entire family unit. Long-standing misconceptions like papaya can cause abortion, though there is no scientific basis for that. Some of these have grown over the girls and women in our population. So we need to very targetedly, specifically tell them quick fix solutions and tips of what is doable within their own households and the community. So the clinicians lack time and the patience, and also really lack the knowledge and skills for offering practical tips to the multi-cuisine complex requirements in the community. If a clinician is sitting any nook and corner in India, language is one of the first barriers, time is the second constraint, and thirdly, from which background she comes and what diet you're telling to do, she may not even relate to, how she can go back home and do that. And women's empowerment, of course, they don't have the liberty to do everything for themselves. It's many others in the family who decide. So the task shifting for nutritional assessment is the need of the hour. So we need to collaborate to build the capacities of the entire team of staff nurses and the assistants, whoever is looking after the pregnant women, and many of the point of care equipment where semi-skilled workers also can play their role very well. Availability of counselors, the advantage of the counselor is well perceived, but the availability of educators and counselors, really there is a dearth for that, with 1.3 billion population. I do hope we harness the human resources in the way that they could stand to the advantage of the community. So ABC of Nutrition is a series of programs that we have started from VIGO, from the Pregnancy and NCD Committee, where the A stands for ahead of pregnancy, B is be cautious during pregnancy, and C is continuum of care, tag her for the rest of her life. This in the form of case presentations has been very well received, and now the whole community is waking up to the importance of their role in communicating with the target of the patients that come to them, not to lose that opportunity to do our best. So bringing in the behavior change by apps such as iMoms, which is also devised by one of our own members, Dr. Jaideep Malhotra from Agra, and it's still had a second place in the Atmanirbhar Bharat event. And the technology, if within 5 years, the girl who is 20 will embark on her pregnancy at 25, for example. These are the real tech-savvy youth and the future generation. We did a survey and documented and published the data on where do the girls go to get their information about contraception, or many who are using menstrual cups, where did they get the information? Because healthcare providers are not telling them, or they are not accessing us. 85% are through the digital and 10% to the peer group, only 5% to the healthcare providers. So beyond us, there is this ghost or the cloud, Dr. Google and the rest, who can also do the job even better than us if the uniformity and the robustness and authenticity of the messages are there. Then there's a huge initiative of Mamta TV, where the FOXI has vetted the contents of what should go on the TV in the waiting rooms of both the public and private sector. The Manyata initiative, where the breastfeeding, other relevant messages are given to the mothers of the Manyata certified centers by the staff nurses who encounter them at many, many touch points. And of course, the FIGO checklist, the 3 points available to us pre-pregnancy, during pregnancy, and post-pregnancy, a simple 4-point checklist, which is aligned to our Government of India list of what the clinicians can do in the shortest possible time. You just need to spend 5 minutes. You need to think nutrition and weight first, and you need to see to it that you consistently, persistently follow this up with conviction that this is indeed an important component for the health of girls and women. And slowly and steadily, you will see it translating into the impact that we desire. Maybe even one focus of anemia, make your practice anemia free. That is our campaign. Defeat diabetes is another such. So if we join hands with all the stakeholders that were present today, my very distinguished co-panelists and the speakers for today, I think we will leap several steps forward in creating the change that we so desire. Thank you very much for your kind invitation and your kind attention. Namaste.